Anxiety is a prevalent mental health concern that affects millions of individuals worldwide. It is a normal response to stress and can be beneficial in certain situations, helping individuals anticipate and prepare for potential dangers. However, when anxiety becomes excessive or disproportionate to the situation, it can interfere with daily functioning and lead to significant distress. Anxiety disorders encompass a range of conditions characterized by excessive fear, worry, and avoidance behaviors. These disorders are among the most common mental health disorders, affecting nearly 30% of adults at some point in their lives. Understanding the distinction between anxiety and fear is crucial in identifying and addressing anxiety disorders effectively. Anxiety typically involves anticipation of future concerns and is associated with muscle tension and avoidance behaviors. In contrast, fear is an immediate response to an imminent threat and is often accompanied by a fight or flight reaction. Anxiety disorders can manifest in various forms, each with its own set of symptoms and diagnostic criteria. Some of the most common anxiety disorders include generalized anxiety disorder, GAD, panic disorder, specific phobias, agoraphobia, social anxiety disorder, SAD, separation anxiety disorder, and selective mutism. Generalized anxiety disorder is characterized by persistent and excessive worry that interferes with daily activities. Individuals with GAD may experience physical symptoms such as restlessness, fatigue, difficulty concentrating, and muscle tension. Panic disorder is characterized by recurrent panic attacks, which are sudden and intense episodes of fear, accompanied by physical symptoms such as palpitations, sweating, trembling, and shortness of breath. Panic attacks can be debilitating and may lead individuals to believe they are experiencing a life-threatening emergency. Specific phobias involve irrational and persistent fears of specific objects, situations, or activities. Common examples include fear of heights, animals, needles, or flying. Despite recognizing that their fears are excessive, individuals with specific phobias may go to great lengths to avoid triggering stimuli. Agoraphobia is characterized by a fear of being in situations where escape may be difficult or embarrassing. Individuals with agoraphobia may avoid crowded places, public transportation, or open spaces, leading to significant impairment in daily functioning. Social anxiety disorder, formerly known as social phobia, involves intense fear and discomfort in social situations, where individuals fear being embarrassed, judged, or scrutinized by others. Social anxiety can significantly impact personal relationships, academic performance, and occupational functioning. Separation anxiety disorder is characterized by excessive fear or anxiety about separation from attachment figures, such as parents or caregivers. Children with separation anxiety may experience distress when separated from their loved ones, and may refuse to go to school or sleep away from home. Selective mutism is a childhood anxiety disorder characterized by a consistent failure to speak in specific social situations, where speech is expected, despite speaking in other contexts. Children with selective mutism may exhibit normal language skills, but may struggle with communication in certain settings. The causes of anxiety disorders are multifaceted and may involve genetic, environmental, psychological, and developmental factors. Family history of anxiety disorders, traumatic experiences, and stressors can increase the risk of developing an anxiety disorder. Diagnosis of anxiety disorders typically involves a comprehensive evaluation by a healthcare professional, including a physical examination, psychiatric assessment, and screening for other medical conditions. Treatment options for anxiety disorders may include psychotherapy, medication, or a combination of both. Cognitive behavioral therapy, CBT, is a common form of psychotherapy that helps individuals identify and change negative thought patterns and behaviors associated with anxiety. Medications such as antidepressants, anti-anxiety medications, and beta blockers may also be prescribed to alleviate symptoms and improve overall functioning. Despite the availability of effective treatments, many individuals with anxiety disorders do not seek help due to stigma, lack of awareness, or misconceptions about mental health. It is essential to raise awareness about anxiety disorders and encourage individuals to seek support from healthcare professionals to receive appropriate treatment and support. With timely intervention and support, individuals with anxiety disorders can lead fulfilling and productive lives.